Hi, welcome to Vascular Research UK. I'm Dan Carradine, Vascular Surgical Specialty Lead, and it's my pleasure to introduce this first video in our new series entitled Cutting Edge. These videos focus on upcoming and in-progress landmark clinical studies which will change the way we care for patients with vascular disease in the future. Please do get in touch if you'd like more information or you'd like to contribute to these important studies. It's an enormous pleasure to introduce Thanos Saratzis, Associate Professor of Vascular Surgery over in Leicester and CI of the EVOCC Trial. This landmark RCT is funded by NIHR in the UK and supported by Vascular Research UK and the Peripheral Arterial Special Interest Group of the Vascular Society of Great Britain and Ireland. It focuses on the management of patients with aortoiliac occlusive disease.
Hello, we have recently received funding from the NIHR Health Technology Assessment Programme in order to deliver a national randomized controlled trial, or RCT, called the EVOCC study. This is a randomized trial assessing the clinical and cost effectiveness of endovascular treatments compared to open surgery for patients who have got chronic limb threatening ischemia and anatomically have been diagnosed with severe occlusive aortoiliac disease. The study will take place over the next few years across 30 sites in the NHS. With regards to patients who would be eligible to take part, as I mentioned before, these would be patients who present with CLTI and have been found to have task C or task D aortoiliac disease. And that means that they've essentially got severe occlusive disease of their common iliac arteries or their external iliac arteries plus minus the distal aorta. In terms of equipoise, we have confirmed that most radiologists and vascular surgeons across the NHS would be at equipoise in terms of recruiting patients in this study when we performed a survey across the UK. 144 radiologists, surgeons, as well as trainees came back to us when we performed that survey. The study design is fairly straightforward. The patients will be randomized when they present to secondary care, and the two arms will be open surgery of any description or endovascular surgery, again, of any description. The exact treatment configuration in terms of both arms, i.e. the open surgery and the endovascular treatment, will be decided at each site. So this is a pragmatic trial. We're hoping to do this across 30 NHS institutions. We will recruit, hopefully, around 630 patients over 2.5 years. Minimum follow-up will be 2 years, and we are aiming for a median follow-up of 3 years. The primary outcome is amputation-free survival, but we will be collecting a number of secondary outcomes such as quality of life, healthcare costs, reinterventions, cardiovascular events, etc. This is a flowchart which describes the flow of the study. As I have mentioned, this is a pragmatic trial, so we're looking for NHS patients with CLTI who present to secondary care. The MDT decides whether there is equipoise with regards to open or endovascular treatment, and then we can randomize the patient following written informed consent. The primary outcome of interest will be amputation-free survival, and we're going to perform an analysis both with regards to intention to treat as well as the type of treatment that the patients received. We're hoping to open the internal pilot of the study, which will be the first stage of the trial, at some point later in 2023. The first patient will be able to take part in the internal pilot on the 1st of October 2023. If your site is interested to take part, please can you email us as soon as possible at evoc@leicester.ac.uk. Our trial manager will get in touch the soonest possible, and we're going to try and set up the study at your site. Thank you.